you, Elle. Can you hear me well?
Yes, we can hear you.
Great. Thank you, Dr. Ong, as well as Dr. Fayez, for joining today's panel discussion. For this segment, we'll be very, very interested in your respective roles in the telemedicine practices, in your roles in Dr. Anywhere, as well as Fayez, India. Of course, these are two very different countries, and also the environments are very different. So we are very, very keen to learn from you. So thank you very much for giving your time to us. First of all, maybe we just touch a little bit on your observations on the adoption and changes in telemedicine. We know that the COVID-19 has had a profound impact on our way of life. So how has telemedicine changed in the past 1 year? So maybe you can start off with giving your initial observations. Who would like to start first? Maybe
I would like to start first. Am I audible?
Hi. Yes, very well, Dr. Fayez.
Yes. Hello, everyone. I'm Dr. S.M. Fayez. I'm a consultant in medicine and diabetes from Bangalore, India. So I'd like to start from the beginning of the pandemic, how telemedicine has gained the popularity. I'll be starting with this. Okay. On March 11, 2020, WHO declared COVID-19 as a pandemic. At that point of time, there were almost 1 million cases across two.
Sorry, Dr. Fayez, you got me.
Hello?
Yes, we can hear you now.
Yeah. This led to the travel restrictions, and there was a social distancing had become a norm at that point of time. Okay. At this situation, telemedicine became more and more relevant than ever. It was there before also, but it had become more and more relevant than ever. Okay. There was a need to avoid face-to-face interactions, face-to-face consultations, so as to reduce the risk of disease transmission. Okay. And the patients found this to be a safer option than face-to-face consultations, and people started to get adapted to this telemedicine. Its applications have been applied in other specialties other than COVID-19 as well now, like diabetes, cardiology, oncology, endocrinology, and others. Slowly, with ever-improving technology, today, with the use of smartphone technology, people from various parts of the country are taking telemedicine from various states to the doctors who are present from very far as well. Initially, before this pandemic also, our country people, Indians, were very skeptical of taking telemedicine consultation. Hello?
Yes, we can hear you, Dr. Fayez. Yeah. Carry on.
There was some disturbance, actually. They were very skeptical about using this platform of telemedicine, as it was a very novel idea. And the patients always wanted to travel to see a consultant. And they also preferred sometimes to visit doctors from other states also. So they used to. With the sudden change in the scenario, there was some hesitancy in the beginning, but as time progressed, patients became well-versed with telemedicine. They're able to book the appointments online. They're able to consult the doctors in any part of the country at the tip of their fingers. And video consultations have almost been as satisfactory as face-to-face consultations now. So patients are able to share the reports. They're able to monitor their vitals, where this medical devices are playing a very important role. And they're able to follow. And the follow-up is becoming very easy now with the advent of telemedicine. People are taking total responsibility of their own health now. These are the main changes.
Thank you, Dr. Fayez. Thanks a lot for your comments. How about Dr. Ong? Can I hear a little bit from you then?
Okay, so I think when it comes to telemedicine, when it first launched in Singapore, there's a lot of apprehension about what can be done and what can't. So when we first launched, there was a whole caveat of a list of diagnoses or presenting symptoms that cannot be seen by telemedicine. Means that the moment you even click on that symptom, right, you don't even get to see a doctor, it just rejects you. So what we have learned from COVID, right, is that because of the emergency application, MOH actually allowed all forms of presentations to be seen over telemedicine, including the chest pain, breathlessness. And it actually shows the value of telemedicine even in such scenarios where it's obvious that we cannot address a problem 100%. But it shows that actually having a medical professional on the line is able to quickly advise what is likely necessary and then direct to the most appropriate form of care, while also activating the appropriate form of care such that the connection time is much shorter. And of course, when it comes to economics-wise, right, this is about how we price our services for such cases such that it's still viable economically and worth for the consumer to use the services even though the care cannot be complete. And that's what we have at DA as well, because we have all the services from primary, secondary, and tertiary. So therefore, that's the biggest change, that telemedicine is now applicable for all forms of symptoms. And that's actually very, very relatable to the part about medical devices. In order to deliver better value of care, we do need IoT medical devices in order to derive objective information aside from history to be able to better serve our patients over telemedicine.
Right. Yeah. You touched on a very important point, right, which is regulatory and environment is also very, very important for us to facilitate the telemedicine proliferation, and also getting the necessary stakeholders ready, right, for the adoption of telemedicine. So I think that's one of the key ingredients here. So other than that, of course, IoT devices delivering objective data is also quite important. But what are the, other hurdles do you observe in the past 1 year that also need to be overcome over time, do you think? Yeah, especially in the delivery of better healthcare.
See, first I would like the three key ingredients necessary for telemedicine to work for both doctors as well as patients is, doctors have to follow certain guidelines given by their respective medical councils, and they have to follow basic medical ethics. And once they start the consultation, they have to do complete assessments of the patients. Along with that, they have to assess the virtual signs, whatever they see. So protecting the patient's confidentiality and privacy also, it's a very important thing. So once the consultation is done, we have to ask the patient for any other queries, whatever they have, and proper follow-up has to be given to the patients. These are the key ingredients of telemedicine. So when it comes to the hurdles, hurdles are faced both by the patients as well as from the doctors as well. So patients facing hurdles is like, mainly one thing is understanding how to book a telemedicine consultation is very important for people generally who are having very low knowledge or poor knowledge about the technology. So it has to be given to them. We have to train them in such a way that everyone can book the telemedicine consultation. And patients should have an appropriate equipment, because in our country, everyone doesn't have a smartphone. So patients should first have a smartphone or something like that to book a telemedicine consultation. At the same time, there should be a data connection, which is well versed with the telemedicine consultations without any hampering. And the few patients may not be comfortable for sharing their picture and photograph during the time of telemedicine consultations. It's a very big hurdle in terms of patients facing the doctors facing the hurdle from the patient side, as well as there are some problems which are faced by the doctors also. As the overuse of telemedicine, there is a problem of doctors having some stress injuries, like whatever IT professionals have, due to repeated consultations and all that. Patients, doctors can have some stress injuries like similar to the IT professionals and all. They can have they can have elbow, neck, as well as hands and wrist pain as well as. And one more deficiency here is, as we are not seeing the patient directly face to face, there will be some important signs which we will be missing in telemedicine, because directly seeing a patient is a different thing, and when we see the patient through the telephone or through a camera, it's a different thing, because we are just virtually seeing the patient, not really seeing the patient. So that is one more thing. That is one more important thing.
Mm-hmm. Okay. And Dr. Ong, is there any?
So I think the main hurdle is actually consumer confidence in the quality of teleconsult. Traditionally, a lot of our consults are pretty brief, because once you remove the physical component, right, the consult doesn't last too long, and that can generate sense in the public that telemedicine only can be used for certain types of diagnoses or presentations. So that firstly is a consumer confidence issue. And the second thing is actually more of a remolding of how a doctor think and process a case. For medical school, we've always been taught about physical exam and history. So in the setting of telemedicine is how do we then rely more on history taking to be better able to re-stratify a patient for severe outcomes. And then that's how we apply telemedicine more broadly. And the last one that actually we don't really think about, right, is about devices. Of course, in terms of having an accurate device, if we can have like respiratory monitor and so on and so forth on the market, it will really help a lot. But a lot of these devices are made such that these multiple use device. And in these times of COVID, right, sanitization of these devices becomes a huge problem that no one really anticipate. Just to share, we actually deployed 300 to 400 medical kiosks throughout all the dormitories in Singapore. And then we found a problem is that it's quite difficult to sanitize it and use in a safe manner. And then it became more like the people had problems using it. Then if you spray alcohol and then you don't wipe it down, after a while there'll be a thick film of alcohol developing over the device and then it spoils. So all these things were something that we actually have to think through first. And actually from a device perspective, we do hope that at some point of time we can get some more innovative device that certainly more disposable in a sense as well, that can be applied as well. So that's food for thought lah. But I think that's the next wave and next future for telemedicine, to be able to very, very accurately re-stratify our patients and then play our role in the market.
Right. Thank you so much, Dr. Ong, for that feedback. I think it's definitely one area that we should look at. And what's also important, I think, my observation is that the role of a medical device now is decentralized from clinics, to really much higher dependence on home as a data point in that sense. So especially I think in terms of chronic disease management, and in this case we are talking about conditions like asthma, hypertension, and especially in India, diabetes, right? These are, I think, relevant areas where I think telemedicine can really play a part. Perhaps you can also share a little bit about where it has played a role in contributing to the management of patients in these areas, but also what other forms of support do you expect from a manufacturer like Omron, in the area of chronic disease? Maybe we can start first with Dr. Ong in this case.
Right. So when it comes to devices, I think one of the most important feature is basically API integration. The most difficult part we have on consumers, even though in Singapore we do not really have issue with people using smartphones, but the problem here is that people don't like download too many apps. So when we have a proliferation of apps, right, people forget their passwords, their usernames, and then you get a bit of issue. So the key concept here is having an SSO integration for most of our platforms. And with that, then this will take off, because the whole point is to make it as easy as possible such that it becomes a repetitive behavior and consumers will then commit to taking my blood pressure every day. I mean, you have a lot of ridiculous stuff happening where you go to a clinic, doctor does a blood pressure for you one time, it's high, okay, lifelong blood pressure medication. And we all know that's not true. It doesn't work that way. So actually, if we are able to get consumers to do their own blood pressure at home and have a proper blood pressure diary, right, then it is much easier for us to then really serve their best interest and only start medication when truly necessary. And that's how we can give value to our patients. And that's something that easing it in through all these more seamless platforms will make a huge difference. And of course, ease of use lah. I actually like to really say that the new device you have, the Omron, that is actually attached on direct without the wires, is wonderful, because a lot of patients don't really even know how to use the wires and always entangle up. So that one is really great. And even all my old folks, like 70, 80-year-old patients, without any teaching from me, they see the device, they just hook it on, done. So that was fantastic and really appreciate it. Yeah, thank you.
Thank you. Thank you very much. Yeah, thank you. Dr. Fayez, can I hear from you then?
See, now medical devices are starting to play a very important role in a country like India now. When we are in between a pandemic and now telemedicine has almost replaced the normal consultations now. Previously, patients used to come to the clinic. We used to check their vitals. We used to do everything and on the patient's visit. Now, as we are seeing the patients virtually, all the vitals have to be monitored by the patient himself. Here the medical devices come into picture. Like Omron has already started giving the Omron BP machines, pulse oximeters, weight machines, and thermometers and all these things. So most of the patients are using that. And it is becoming very easy for the doctors to monitor. And there are few apps like Fable. They constantly update the data of the patients with the doctor. They have different cards like green, yellow, and red and all that, issuing warning signs and all that. So now it has been even more to monitor the vitals of the patients easily. And if something is going wrong, immediately we call the patients and find out that what is the problem and to correct any intervention. If, for example, if the BP is high, we get a red card. So we reach out the patient and we change the medications, we increase the dose of the medications or decrease the medication dose. In case of diabetic patients also, sugars will be monitored regularly and we can see the patient's sugars. And if the sugars are going very high, then in glucometer readings, we adjust the dose of insulin or oral anti-hypoglycemic agents and all that. So this has played a very important role especially in diabetes, in case of hypertension, in thyroid disorders. Now slowly other departments like endocrinology and oncology, everybody is starting to use this technology. I think medical devices are playing a very important role.
Okay, thank you, Dr. Fayez. Also, maybe I can just address some of the areas that I think Dr. Ong as well as Dr. Fayez has touched on. I think in the area of seamless data transfer, I think Omron recently has already made that possible with API integration. We are working especially with Fable, and currently I think something is going on with Doctor Anywhere to start integrating our apps so that data can be seamlessly transferred from our customers to your platforms, so that we have very effective as well as accurate transfer of data points, right? That will, I think, support the management of these conditions such as hypertension, diabetes. The other very important, I think, area that we always think about is ease of use or accuracy, because I think user errors are always a very, very important consideration. And in certain devices, especially use of the blood pressure cuffs, the inaccuracy of the devices are usually because of user errors. So innovations such as the IntelliRad cuff eliminate such errors. Yeah, so I think those are the examples of considerations that Omron has been thinking about. I do have one question from the audience that maybe we can also address here, which is, can Omron provide digital medical devices for remote monitoring used for home-based healthcare integrated in the medical record in central office? Yeah, so it is possible, and I think Dr. John, please reach out to your local Omron representative. We will be able to support you in that. We have data solutions that will support that as well. Yeah, so we have case studies with Fable, with other service providers in the region that will support that. Yeah. So closing comments here, because I'm mindful of time. As we wait for COVID to pass, we know that telemedicine has received a booster shot, right, in terms of adoption because of COVID-19. But what is your take here? Do you think that it is here to stay, is the new normal, or do you think that it's a passing fad after COVID-19 settles down? What is your take here?
Telemedicine is here. Yeah, telemedicine is here to stay, as more and more people are becoming aware of this. So the bookings of telemedicine is increasing day by day. It is even time saving also. It's cost effective. So patients can have expert consultations at the tip of their fingers, sitting at the walls of their home. So I don't think this is going to go away, and this is going to become a new normal as time progresses. And then medical devices are going to play a crucial role in this.
Thank you, Dr. Fayez.
So I think for telemedicine, right, it is recognized that it's become one of the means of seeing a doctor. So it will not be the new normal in the sense that physical clinics are all not going to shut down and then everyone become digital. That's not going to happen. But it become one of the pillars of the way that you actually sought care, as well as in terms of one of the ways that care can be delivered. So the important stratification is then to understand what kind of condition should you see what, or maybe telemedicine being the first line for everything, and then from there devolve down to all other forms of care could be another way it develop as well. And this is where what makes the core difference is about the devices. One of the concepts we have as company with before is that, if you can buy a furniture, like you can buy a bed, you can buy a fridge, why not you buy a home kit with a BP device, heart rate monitor, as well as a stethoscope? Every home has their own. And then from there, we can actually deliver very high quality telemedicine to every home. And it actually makes perfect sense. And device cost or something like that is actually less than 700, 800. So it is a viable electronic furniture, especially when we talk about the IoT, going from home, a smart home. Medical actually forms quite a big portion. So that's where it'd be quite exciting to understand and see how this market develops in the future. Yeah.
Right. Thank you. Yeah. So I actually have a very this is a question that just popped up, right? But what do you think? I mean, do you actually think that as data becomes a lot more available from patients, would you like to see support in terms of algorithms to basically help stratify risk for patients in terms of cardiovascular outcomes? I'm talking about hypertension here. So how do you see that the adoption among healthcare professionals will actually pick up as we develop in this area?
Yeah, I think so. So in telemedicine, there are some limitations as well. When the patient comes to you, if the patient is stable, all the vitals are stable, you can treat him at home. So you cannot go on treating the patient on home itself by taking the vitals. We should know when to cut off and when we should escalate, and when the patient requires the need of to go to a center, meet a doctor in person. So I think there should be an algorithm which can stratify the risk of the patients, like mild, moderate, and severe, in case of hypertension, in case of diabetes, in case of any other chronic diseases. So once we start this, if the mild category can be treated at home, moderate and severe can visit the patient in the clinic or in a hospital for that matter. So once the medical devices are in, we have already started it in Fable. That is an online platform what we are using here in India. So we have parts, we have grades of patients who are mild and moderate and severe. And once they generate a red card, the patient comes to the clinic. So when the vitals are going more worse than the normal limits, then there is a card which is generated for each patient. And that's how we developed an algorithm for stratifying the patients with the risk. So, and medical devices are playing an important role in this. And I think they should go.
Okay, thank you.
And I think when it comes to algorithm, right, it's actually quite cool where you mentioned that, because very traditionally, we always look at like low BP as defined by 90 systolic and then high BP as 140. But once we have more data and more data trending, then actually the signature of how the BP evolve from a time-to-time basis can then form a new diagnostic criteria. Of course, we have to do some evidence-based studies on that to confirm the validity of such criteria. But this kind of new monitoring can then become an actual new gold standard in picking up early disease, such as a rise in respiratory rate and how fast it rises by and so on and so forth, has also already been shown to be indicative of early sepsis. So these are the kind of things where devices can actually be the new forefront in actually predicting onset of early disease far earlier than before you get system collapse. We all know that by the time you have a tachycardia of 110 and above, right, you already are in class 2 shock already. So we need to know before that. And that's where all the conglomeration of data can become your new diagnostic criteria and make a very, very big difference. Yeah, even in physical clinic.
I hope this becomes a reality sooner than later, really. But thank you so much for your time. And I've gleaned actually quite a lot of insights from both of you, and hopefully for the audience as well. Thank you, Dr. Ong and Dr. Fayez. Over to you, Elle.